So, when we're discussing medical records, I've talked about this briefly on a number of occasions. Electronic medical records became a thing in the early 2010s. They were not legally required until about 2000 and I want to say 13. And even when they first became legally required, they were majorly being enforced through Medicaid and Medicare, through government funded programs. Commercial insurances were still taking billing submissions with paper charts. And doctors from small private practices were kind of forced out of their practices and forced to combine with much larger hospitals. Northwestern was one of them. Northwestern acquired the majority of the standalone independent practicing physicians in the downtown area. And upon doing so, implemented various electronic medical record systems. The hospital that I worked for, or the private doctor's office that I worked for, used AthenaNet at first, with an Epic integration for hospitalizations and when doctors were doing rounds, etc., and so forth. Now, when a doctor is writing on a note for a patient, and when you're inpatient or outpatient, when a doctor is typing up a note for the patient, the template is pre-built. So the template is what asks for the HEENT. It's what asks for a review of systems, ROS. It's what asks for a plan of care. It's what asks for discharge instructions. And based on specialty, there are a wide variety of additional questions that are asked. And it's not just specialty, but specialty has something to do with it. It's also doctor preference. So when you bring in the EMR people, the technologists, to build out your templates, you kind of, as the doctor, say, okay, I want this, I want that, I want this, I want that. And going electronic and joining with these larger corporate conglomerates reduces a lot of risk personally to each physician, but it also takes away all of their freedom mostly. When a doctor has a note, and the note is, like I just described, that templated piece of electronic medical record that asks all the questions, the doctor cannot simply not answer and close the note. In most cases, there are specific parts of the template that are required for billing purposes. In the early days, in the early implementations of electronic medical records, so up until probably about 2020, and even after that, people are still fine-tuning. The more in-depth the questionnaires are, the more room for error there is. Have you guys ever taken a multiple choice and you don't know the answers? And you're reading the questions and you're like, I have no idea. And you just get exhausted of it and you're like, C, 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 A, B, A, D, whatever. And you get rid of those last 10 questions and turn in the test. It's kind of like that on some of these templates. So going back in an electronic medical record to dictate a person's physical health, plan of care, etc., and so forth is incredibly difficult, especially in these earlier years of electronic medical record implementation, to deem as truthful or reliable. It's also incredibly unreliable to think that a doctor who saw a patient for 10 minutes once or twice is going to remember that patient. Especially when it was several years ago, the longer, the harder it is to remember. And when we're talking about a physician who's doing, on average, 20 patient visits a day, and they work 5 days a week, that's 100 patients a week, not including inpatient or rounds or consults or, things of that nature. And now how many weeks are in a year? So we're talking on average, let's give them a couple vacations throughout the year and say they're taking on 3,000 patients a year, which is a very generous underestimate. for the doctors I worked with anyway. So if you're working with 3,000 patients a year, plus you have any sort of a social life, plus you're meeting new doctors, plus you're meeting new administrative staff, plus you have a family and a home life, your mental capacity, if someone asks you, can you recall a person from this amount, from this year that you met with for 10 minutes, that recollection is going to be highly unreliable at best, if they even remember at all. Where was I going with this? Oh, yes. So basically, overall, in the development of electronic medical records, much like all other electronic charting, if you look at police used to have to go and fill out a piece of paper, a date of incident, what happened in the incident. I don't know the exact technology and questions that are used for the policing, charting. I speak medical language. I speak, medical abbreviations. I could write you a prescription for almost anything, and I can tell you exactly what the dosings are and, what the SIG is. Like, for instance, if the doctor wanted you to take a baby aspirin each day, they would write to the pharmacy, aspirin, SIG with probably a 0.81 with a SIG of take 1 tab, PRN, or Q day, depending on what it was. So PRN is as needed. QD is once a day. BID is twice a day. TID is three times a day. Lateral, posterior. They use these kinds of terminologies. I don't understand that language in policing or in legal. They have their own language as well, but I do understand it in medical. Now, very much so, it's incredibly common that, as I said, if you look at these long, tedious templates, especially before the EMR was developed and customized to the doctor individually, you have to click stuff. You have to click stuff to close the note, and you cannot submit a bill until your note is closed. Now, if you're in a private physician's office and you're the owner, who's going to yell at you? You might yell at yourself. Maybe your significant other will yell at you when the light bill is due and you're, $10,000 in the hole because you haven't submitted bills in 3 weeks, and you're seeing patients and not submitting bills, so you're getting no. That's very realistic. But in moving along to a hospital setting, you're not allowed to not complete those templates. So you have got to close those chart notes in a reasonable amount of time. There was one doctor that I worked with who was terrible at closing chart notes. I mean, awful. And I would have to sit there with administrative, preferences and close this doctor's chart notes for him, and go through and check that the, legal things were done and filled out completely, and reference the paper chart and close them. I mean, his assistant was only able to help him and ended up quitting. Many assistants could not cover for him. I was one of the few that could, hear what he was saying and give him the type of assistance that he needed to close these notes. But he was very, very, very bad at it, and he was not alone in that, especially with the older generation of doctors coming in with the electronic implementation and integrations. Now, besides clicking stuff just to get, your note closed, there's also another consideration for the reliability of electronic medical records in their earlier years. Today, most electronic medical records offer some sort of indication for environmental, not considerations. What's the word that means you do what they say that they require you, or that they recommend you to do? You are not compliance, patient compliance. Sorry, thank you guys, brain fart. So when we're talking about patient compliance, back in the old days, doctors would just scribble out the patient is not taking their medicine, and they would probably write something like, let's say for instance, it was because they didn't have money to afford it. They would write, patient cannot afford medication, in their scribbled handwriting. you know. Now there's none of that in the EMR. This is what I prescribed, this is the review of systems, this is the plan of care. There is no did the patient do what we told them to do. There's a free note section, but there's not really that templated questionnaire that came with handwriting on paper charts. So what they're doing is, or what they've done is, they've now started to integrate a separate section for environmental risk factors and then environmental factors that prevent compliance, which I think is excellent and such a huge advocate to the patient. Especially when you're looking at a situation where you have to deem whether or not a patient can or has taken care of themselves. If a patient can take care of themselves, meaning they are physically and mentally able, but there is an environmental circumstance that is preventing them from doing so, i.e. poverty, for instance, just one example, it's important for the doctor to understand that. And looking back 10 years from now, looking back on today, or 10 years from now, looking back 20 years, having those notes is going to be very important in understanding people's situations. But what I warn society about is that it's also going to be very, very pointed in saying, wow, a lot of people were suffering and a lot of people were not suffering. And there's going to be accountability, and it's going to come to a point where the records that are electronic on who was taking out $100,000 car loan and who was not able to afford their insulin, that's all going to be electronic, and it's all going to fuse together to tell a story. And that story is going to be the story of our lives and the story of the human race, of the modern civilized human race. And it's all going to come together. And what are you going to say for yourself when it does? Were you one of the people taking out a $100,000 car loan? If so, did you donate 20% of your annual income to some sort of charity? Were you charitable? Did you help? Were you involved in solving the world's problems? Everyone's so worried about, they commonly reference this Elon Musk, Joe Rogan interview. I can't even tell you the number of times that interview has been referenced and brought up in conversation when I've been speaking to people about various artificial intelligence subjects. And that conversation, again, that's Joe Rogan and Elon Musk, where they're discussing artificial intelligence. And Elon Musk expresses a genuine fear for where artificial intelligence is going. And I don't share that same fear. However, I think it is very realistic and highly plausible that considering human beings and our true actual behavior is what programs artificial intelligence. If something does not change dramatically and soon, what Elon Musk fears could very much be truthful. Now, for someone like myself, who's been living in the middle, below the oppressors and above the oppressed, for the most part, I've been fairly oppressed the last 5 years, but for the majority of my life, I've kind of been right there in the middle. And when you're living in that space of the middle, much of the blame, you're going to be looked to be a kind person for the most part, obviously within reason. There are always exceptions. No one is perfect, but you're going to be looked to be kind and to do what you can do for society. When you're operating from the oppressor perspective, there's going to be a lot of fingers that are going to be pointing, and there's going to be a lot of questions that need to be answered. How could you is going to be the very first one. How could you look the other way and allow these people to suffer? How could you exploit these people out of being able to afford their medications while you're driving around in a Rolls Royce or a Bugatti or a Bentley? How could you be chartering a $100,000 yacht for the weekend when there are people who, are going to be hospitalized because their blood pressure or blood sugar are out of control and they cannot afford a simple and common treatment for those things? How could you, spend $40,000 on new boobs and a new butt, but you haven't donated a penny over the last 2, 3, 4, 5, 6, 7, 8, 9, 10 years, right? So these are all questions that AI is going to put together, and I've talked about this as well, and I got to go. I need to pump right now. By the way, if anyone wants to donate, I need a backup pump. I'm seeing Weston and breastfeeding him 3 days a week. I pray that it'll be increased very soon. I have no criminal record or anything, so I can't really get into the reasons why this is happening. Mostly I'm confused over them anyway, but if you'd like to donate, please do so. My Instagram is 1HeatherGee, VLAW. That's VLAW, 1, the number 1, Heather, HeatherGee, VLAW. It's 1HeatherG, VLaw. And my Cash App is posted there. And I'm accepting donations on Cash App. I really need $100 for a backup pump. My pump started making a loud noise. I've only been using it for 3 months, and I have to keep pumping to keep my supply sustained for my son. It's very important. It means a lot to me that I get to keep breastfeeding him. He's only 3 months old, and it means a lot to me. And so I need to pump on the days that I'm not with him. Otherwise, I begin to lose my supply. And I need $100 for that. It's $79 or $69 for the pump and $30 for the phone. But either way, I've discussed really quickly, and I'm only going to give this about 5 more minutes. I had a few requests to discuss this subject. We are all creating a file for our lives. This file is not being held in any sort of filing cabinet that's tangible, but rather cloud-based servers, and in this blockchain or electronic footprint or electronic file, all of our prescription refills, everything billed through our insurance, all of our medical records, our phone bills, our phone records, our text message history, what we like and don't like on social media, the comments that we post on social media, the photos, the interactions, our campaigns, our resumes, our professional and personal resumes, clubs that we've belonged to, credit card histories, bank statements, all of these things, TV shows that we watch. Do you guys know that on smart TVs you have to be logged in? Usually most people are logged in through Gmail. Our Netflix accounts, our Hulu accounts, our Gmail accounts, our email accounts that are not related to Google. When we log into the TV, they keep a record of what we watch. When you pull up YouTube, we're programming every single day through algorithms of human behavior. We press the little like, we tell AI, she likes this, let's give her more of this. We press the don't like, AI says, okay, she doesn't like this, let's give her less of this. We write a comment, AI is not completely there yet. AI is generative right now, but it's not completely automated to do anything a human can do that we know of. But if AI can take a guess as to what you're thinking and what you're trying to say and generate a statement on your behalf that 99% of the time you're going to read and say, wow, that was perfectly articulated and exactly what I wanted to say. What do you think is going to happen in another 30 years of this development of this technology? So when we're talking and referencing back to that interview between Joe Rogan and Elon Musk, what we really need to be asking ourselves is, if AI treated me the way I treat me and the way I treat others, would I be okay with that? And if not, we need to really make a realization that it is our behavior that is programming artificial intelligence. Artificial intelligence is learning from us. They are looking for larger data sets. They're getting them whether we like it or not. Every time you pick up your phone, you are contributing to the data set. So before you go and type some negative comment on someone's wall, before you go and slander someone or harass someone or libel someone, it's really, really important that you educate yourself, that you learn what you are doing in the big picture for not only yourself, but for the entire community, for society as a whole. So I'm gonna go pump now. Like I said, sponsors, I haven't heard from you guys all week. If there's any sponsors in the audience, if you guys could please help me out ASAP with this breast pump, the backup breast pump. Mine is working, but it's making a terrible noise. It's just loud and whiny sometimes. So I would really be grateful if you could send that through Cash App. And the link is posted there in my Instagram. But yeah, this is Friday night, May 24th, 2024. I'm Heather Gillespie, and I'm going to get off of here and pump. You guys have a great day. Night.